McCusker Charitable Foundation Award for Excellence. This is an achievement award which recognises an individual who has made a sustained and outstanding contribution to mental health. The finalists are:
I'm Tony Henderson, and at the moment I'm working with the Community Culture and Mental Health Unit with the School of Psychiatry. The passion that I have in terms of mental health is associated with education. I really enjoyed teaching and working with young people and helping them to see what the possibilities were. In the past, when I worked at Greyland, it was static. There wasn't any movement. Change was virtually impossible. There was a lot of obstructions to change. Guy Hamilton, the psychiatrist at the time, felt that it wasn't appropriate for people with an intellectual handicap to be in a mental institution. So I was involved in that process from an educational perspective, working with students, teaching them more about social learning processes rather than treating it as an illness. We introduced what's now known as the nursing process into the school. There was a lot of resistance from the older staff. So introducing the nursing process was an exciting time, and I think it's become standard practice now in mental health services. For me, in terms of my research into recovery, is that what's come out is people have talked about their recovery, but they've also talked about their resilience. In terms of future research and perhaps for future service delivery, how consumers construe resilience, what it means for them, and in what ways are they resilient and in what circumstances, and then build that into the services as part of the recovery process.
Hello everybody, my name is Diane Winaden, and I'd like to wish you all a happy Mental Health Week, and it's really exciting to be part of the Good Outcome Awards this morning. I hold the position of Professor of Mental Health at Curtin University, and I've worked in the area of mental health for approximately 40 years. When I started in mental health, I was a clinical nurse, and I worked at Greylands Hospital and at Heathcote Hospital, and then I went into the area of education, and I used to educate the nurses in the hospital-based mental health nursing programs, and have seen deinstitutionalisation and now the emphasis on the promotion of recovery. One of the research programs that I'm most passionate about is trying to improve the university experience of students, upskilling our staff. At least 140 of them now have completed the mental health first aid training, and we run that regularly on campus. Just recently we have now embedded mental health first aid in the first year of our program, so all of our nursing students during the first year will do mental health first aid. So this is a really important first step in introducing students early to mental health in their program. I love my job. I love promoting mental health. I love working to make a difference and to see people improve and go into the community and live productive lives. It is one of the goals that I've always held in my care.
Good morning, my name is Margaret Doherty. I'm the convener of Mental Health Matters 2, which is a community action and advocacy group in Western Australia. I started my journey in mental health approximately 10 years ago when one of my family members was hospitalised for the first time. That came as a shock to the system. We weren't prepared for it, we had nothing to go by, and as a migrant family we don't have that natural extended network of family support that perhaps might be there for other people. So myself and a group of folk got together. We started Mental Health Matters 2, which now has 500 plus members and a very active Facebook page. So one of the things I'm most proud of is agitating for and lobbying for a court diversion programme for people with a mental impairment. And after 2 years of talking about it endlessly, when we thought we would get tired of listening to our own voices, government announced the funding for both a pilot programme in Perth Magistrates Court as well as a programme in the Children's Court. And we were really proud of that achievement. We're also very focused on recovery. We firmly believe that people and their families can and will recover from mental distress given the right supports. It's really important that people work with families as well as individuals, both for the individual as well as for the family. Sometimes families need healing as a whole, and it is within our families that sometimes we get the best support and the best learning.